Hello, I'm Richard Snashall and I'm a filmmaker working on the Be Strong series. Welcome today to this panel discussion which is produced by the Rural Health Education Foundation as part of the Be Strong series. Evaluation of a program to determine the effectiveness of a campaign or project is often a very challenging process. Today we're going to be discussing elements of the evaluation process to highlight ways in which programs supporting the cessation of smoking can be assessed for success in achieving particular predetermined outcomes within a community. Before I welcome our panellists, I would like to acknowledge the traditional owners of this land, past and present, as we meet on the land of the Ngunnawal people. Well, now I'd like to welcome our panellists. We have Damien Shen from Drug and Alcohol Services South Australia, and Damien has been an integral part of the development of the Give Up Smokes for Good campaign. Great to have you here, Damien.
Thank you very much.
Wayne Hippai is a regional tobacco action worker from Kabul Aboriginal Health Centre in Toowoomba, who's been involved in a quit smoking program in his region, which is supported by the University of Southern Queensland. Thanks for coming down, Wayne.
Well, it's good to be here.
Summer Finlay is currently working at the Aboriginal Health and Medical Research Centre Council in Sydney and has been involved in a number of projects in rural and urban New South Wales. Welcome to the program, Summer.
Hi, nice to be here.
Well, Summer, actually, if I can begin with you, some of the projects you've been doing in Dubbo, Albury and Inverell are quite specific to target audiences. If you could tell us a bit about what you've been doing.
So we have a social marketing campaign called Kick the Habit, and this was phase 2 of it. What we actually did was put out an expression of interest to our the Aboriginal Medical Services in New South Wales, and we got 3 that wanted to participate with us, and we actually worked with them around identifying which target audiences they felt within their community they wanted to target. In those communities, it was actually parents with kids in Dubbo, in Albury-Wodonga it was elders, and up in Inverell it was youth.
Now, Wayne, at Kabul, you've been working on a project over the last 18 months, and I believe you've got other projects on the go as well. Could you give us a bit of an outline of what you've been doing?
Yeah, basically the program is called the iQuit program. I run the program over 18 months. It was basically doing one-on-one consultations through the clinic, so tobacco consultations, just ongoing support, getting referrals from a GP to the smoking team and just assisting those, our community with quitting smoking, yeah.
And Damien, if we can ask you a little bit about what's going on in South Australia. You've had a big campaign which has been rolling out in stages. Could you give us a bit of an outline of what you've been doing?
Yep. So for the last close to 3.5 years, I've been coordinating a campaign called Give Up Smokes for Good. It's a campaign that utilises paid and unpaid media to get our messages out there, and we also do grant funding to programs as well as event sponsorship and community engagement to reach the community pretty much across metro and regional South Australia.
What prompts a project to, for you to design a project and create a project? Maybe Summer, if you could.
I guess one of the things for me when because I've worked in community-controlled sector, both in Victoria and New South Wales, it's really working with our member services and community control to identify their needs, to be honest. I mean, there's no point me sitting in an office deciding for the rest of the state what a program's going to look like. So we engage a lot with our members, talk to them, we listen a lot, and then we try and actually create something that might be useful for them.
And what about yourself, Wayne, at Kabul?
Something we do at Kabul is engage with the community at community events. So I'm doing surveys and feedback, so like to get some baseline data there on what the actual needs are around tobacco, or just poor nutritional choices, and just basically have some questions around smoking and all that sort of stuff. We collate the data, and obviously we develop a program that's tailored to suit our community needs around that. Yeah.
And Damien, in South Australia?
To start off with, we had to identify the problem that we were looking at from a social marketing perspective. From there, reviewed, there's a pretty big body of research and evidence in the tobacco control space. So we reviewed that and then basically created a strategic framework in partnership with some community-controlled organisations that we were going to roll out into as pilot areas when we first started. And we utilised a social marketing expert, Dr. Tom Carroll, to help actually create that framework for us, and brought the community along as we developed that sort of the foundational strategy.
So using expertise like you've used Dr. Tom Carroll, did you do anything similar, Wayne, bringing in some outside consultative expertise?
Just with the university coming in to do some, looking at evaluation strategies. So what sort of questions, quantitative, qualitative sort of questions, data that we can use to obviously get that information that we require to obviously develop the programs around. So we use a few external resources like that. Yeah.
In South Australia, Damien, have you got a particular evaluation process in place? Did you have something developed before Give Up Smokes for Good was rolled out?
Yeah, so in South Australia, our funding was split up. So we cut off a chunk that went specifically to the marketing component, and then allocated a certain amount which went to evaluation. So the marketing and evaluation ran side by side right from the beginning. We worked with a third-party agency, Tobacco Control Research and Evaluation Unit, which was housed in the Cancer Council. They provided a project officer over there who has been evaluating the campaign right from the beginning.
Summer, with Kick the Habit, did you have an evaluation sort of strategy in mind early on?
Yes and no. So we actually have evaluated the Kick the Habit campaign, and we did start developing the evaluation reasonably early on, but there were some hiccups, as there always is when you work in a community-controlled sector. So we actually did develop a pre and post survey, and we've done semi-structured interviews, and I have written a report around that as well. So it was, getting back to the question of engagement, actually, one of the things we did find was getting people engaged in the evaluation process, and that's where we found some difficulties and why there was a few hiccups. So we did have a plan, but not everything went to plan.
But you did use those surveys? And
Absolutely.
And
absolutely.
how did you distribute them? And
well, we initially had a PDA, which is a personalised digital assistant, little handheld thing. And we went out to the services and we engaged with the key contact out at each of the services we were working with, and we got them and us as well to actually go around and ask people to fill in our survey using the PDA. When we did the post one, we got a little bit more techie, which is fantastic. We actually got a tablet, and we did the same thing, and we went out to the services and got people, community members and staff to fill it in. So
using that technology was handy?
Absolutely, absolutely. Stole the idea from another community-controlled organisation, actually. They use tablets quite frequently.
It's called sharing, by the way.
Oh, yes, sharing. And people are actually much more engaged because with touching the screen, I guess it's much more interesting than writing.
Did you use any technology, Wayne?
Just your basic, your spreadsheets and all that sort of stuff. So developing your pre and post evaluations for focus groups, or say if the GP's referring a client to myself or the program, having all of that sort of data there. Do they have a chronic disease? How many they smoke? So just sort of keeping that baseline data at the start, and then over a period of time you can actually see if they're decreased smoking rates, or they're on top of their, physical health, or they need certain self-help strategies in certain areas. So, basically the IT sort of stuff, spreadsheets, Word documents, all that sort of stuff. I think the important thing is to keep that sort of electronic paper trail is a good part of evaluation and for reporting purposes. Because without that and a good evaluation tools like those, maybe the funding can go somewhere else. So it's much needed. Where it is now, I think, yep.
And with the University of Southern Queensland, how were they involved in that evaluation process?
They were involved at the end of the project. So basically, once I've collated all the baseline data, how many smokers were at the start of 6 months to 6 months later, done up all your graphs and all that sort of stuff, they'd actually assess the report that I've actually submitted, and then just tweak it a bit and sort of beef it up, as you'd say, yeah. Yep.
Summer, you have a particular getting to know your community data tool?
So I worked at the AHMRC on a number of projects, not just Kick the Habit. One of the projects that I led was the Aboriginal Tobacco Resistance Toolkit. Inside that toolkit's a number of modules. One of the modules is around data collection, because we know that it's really important to get data, but a lot of community-controlled services or even mainstream services to some degree, they're interested in their clients and they don't have the opportunity to sit back and actually think about what data they can collect. So what we did was actually consult with our member services around what would be useful, what tools would be useful and templates, and we basically put that all together. So now they take our tools and adapt it to suit their own needs. And one of our services recently used the survey that's within their tool kit to actually survey 170 people in 4 days within their local community. So, yeah, they're using it and it seems to be doing quite well.
And Damien, in South Australia, have you been using sort of any particular tools for your evaluation?
Yeah, we've used a combination of sort of paper-based questionnaires for testing creative concepts. From there, once the campaign has been running, we've then done a combination of focus groups, so to get a feel for the appropriateness of the creative and things that might need to change. And then while the focus groups run, we also do intercept surveys through health services. So we've done 2 stages of that now. And actually the third thing there, or the fourth, I've mentioned, is key stakeholder interviews that we do at the end, just to see how we have worked as an agency with our partners, and whether the materials that we're developing are actually value adding to the work that they've been doing. So the most recent round of evaluation, we've just got our report back, and we ran 12 focus groups across 3 regions, and that was about 83 participants with the focus groups. And then with the intercept surveys, we collected about 370 across 4 regions. That's testing recall of our particular campaign, and also like people who have been exposed to the campaign, are they changing behaviour to any degree in certain categories?
Have you found, and I will ask each of you this question, have you found that you've made big differences to your campaign over the years as you've evaluated the material that's come in, the information that you've been getting?
I'm not sure if I'd say big differences, because I think when you start a campaign and you think about what your communication objectives are going to be, you have to, if you start making these really big sort of statements and goals within, say, a funding period of 3 years, I think you just got to be really careful of what your expectations are going to be after 3 years, because if we consider what's been going on in mainstream tobacco control since the war, since all these guys came back as smokers, it's taken 30, 40 years to get the smoking rates right down. So if we're trying to get this amazing result in 3 years, I think it's a little bit unrealistic to do that. So for us, we're keen to see attitude change around say smoke-free homes and cars. If more people who have been exposed to the campaign are having smoke-free homes now, and then but also the one of our other objectives was people understanding that they're also a part of supporting other people to quit as well. So we had some pretty basic communication objectives. Those were 2 of them, and the important one is that people are actually having a shot at quitting themselves if they're a smoker. So I think we've made some ground in all 3 of those areas. So, but I wouldn't say results are massive.
What about yourself, Wayne?
Yeah, well, with the clinic, it's a bit different to a social marketing campaign. It's more clinical based. Like there have been minor impacts with reduced smoking rates. There was 40 odd clients I was seeing through the centre, and a good stat is most of those, probably 30 out of those 40, have halved their smoking within the first 2 weeks, and over a duration of 18 months, nine community members actually quit successfully after 3 and 6 months. So there was evaluation after 3 and 6 months to see how they're going and all that sort of stuff. But the impact it had on the clinic, the screener where the community member comes in, gets screened before they see the GP, can actually take the data, you know, do they smoke? And before I was employed there, none of that was happening. So it's increased the data there by 90%, 95% off the bat. So working within a team, you know, so in the clinic, working as a team is vital for communication and for the whole client's journey as well. So coming through from the start, seeing the screener, the GP getting referred to tobacco worker, and obviously having that feedback and communication there. So it has had a minor impact on certain areas, but like with the rates and all that sort of stuff, but major as a teamwork, and also in the wider community, everybody knows that I'm there at Carbal, and within the team, if anyone needs support there, they know where to come to get it. Yep.
And Summer with Kick the Habit.
One of the things I think is more difficult for us, because we are a social marketing campaign and also because we work at a state level, is knowing exactly how many people have quit from what we're doing. And so, because there's so much noise in the area, particularly since the investment from the Commonwealth. But one of the things we have noticed, and our member services have noticed, is that more people are coming in to talk to them about quitting smoking, and more people are actually coming into the medical service and seeking support more broadly around those issues where before they weren't. So we were interested in a number of different things with our campaign, and the two we definitely know that we've had an impact on is the increased number of quit attempts, but also number of people coming into Aboriginal medical services and engaging in those conversations.
Just walking in the door.
Yeah, which is really important, because if you think about it, tobacco's been around, as Damien was saying, for a really long time. We didn't actually, in the mainstream population, start really tackling it until the 80s. In Aboriginal communities, we've only started tackling it more broadly. So even just raising the profile of smoking and raising the issue and getting people to engage in conversations is important. I started in Victoria 5 years ago. I rang a CEO and said, hi, you know, I'm a tobacco worker at a state level. She laughed at me and goes, you won't get anybody to talk to you. Now we actually don't, you know, I can engage and we have less of an issue. So that in itself is a major step, even if we aren't aware of how many people have quit just yet.
Now, funding. It's always the big question, isn't it? If you haven't got the funding, or there's no large funding body, can you still evaluate? Summer?
Yes. I have this argument frequently, not with these mobs, but with just people in general. I mean, because there's a couple of things that I find, and these guys have mentioned evaluation for reporting. And quite frankly, I evaluate everything that I do. So I have run workshops, I've been involved in a whole range of things, and I don't just evaluate for my funding body. I evaluate for myself, and I evaluate for my community. Because one, I always want to do better than I'm currently doing. And when it comes to my community, I'm there to work for my community. And if I don't know what's working for my community, then I'm not doing my job properly. So I evaluate on a small level, and we actually at the AH and MRC with our program didn't have evaluation built in, except for just Kick the Habit, so until recently. But I had been evaluating every component I'd been involved in by myself. And most of it's been process evaluation as opposed to impact or outcome evaluation. But yes, you can, and yes, you should. And it could be as simple as having an evaluation sheet at the end of your whatever you're running and getting people to fill it in, or using your PDA, or using your minutes from your meetings, a whole range of things. So it doesn't have to be the huge process that people seem to think it is.
You're saying it's a much more a natural part of whatever you're doing. It's not a separate thing. Oh, yes, we must remember evaluation. Yeah. It should be just built in.
It should be, and it really doesn't have to be that hard. But I think people get this idea because they do see very large campaigns or very large projects that are evaluated, and they then have a very complex evaluation. Now, yes, your evaluation may not get into a peer-reviewed journal article, but is that really where we're aiming to be in our community? So, and I think, you know, you're not doing your community justice if at least you don't know what is and isn't working.
Do you think a lot of people need, perhaps, you know, smaller communities that don't have the funding, they might need a bit of help along the way to build that type of thinking into their projects or campaigns? Because
absolutely. Everybody knows everybody knows that I love evaluation. Everybody knows that I love data collection. And I'm constantly talking about it. And I'm talking to people about how they can do it. And I'm really, you know, at the AHMRC, we are the peak body and we are happy to support people to do a range of things.
Damien, it was interesting because you mentioned about, you know, you really allocated a portion of your funding to evaluation. But do you agree with some of you sort of see that evaluation as something that should just be there, sort of rolling along underneath while your campaign is underway?
Yeah, well, yeah. I guess that's been the philosophy. Because we've been funded slightly differently, our campaign is state funded as opposed to federally funded. I guess we've got to answer to the state government around all the campaign activities, especially when there's paid media involved. You have to report back on those things right up to the top. So, but that's, you know, even if it was a smaller campaign, we would still evaluate because, you know, with DASA, you know, we'd like to capture as much data as we possibly can generally. And like Summer said, you know, you can do some very economical I guess data collection methods. You can have them, and some of them. And you know, if you're testing creative concepts, you don't necessarily have to. You know, standard practice. If you're doing it properly, you hire a third-party facilitator. You pay per head for people to come in for their time. But if you're linked in with health services, there might be an existing men's group or a women's group or an elders group or something like that. That all you need to do is just put on a bit of a feed. And you've got them for an hour, and you can go in there and test and do a little survey. They love that.
And Wayne, at Carbal in Toowoomba, you know, do you use sort of some of those smaller scale evaluation techniques?
Yeah.
Like Damien said, you might get everyone in for a bit of a feed and a chat, basically.
Yeah, definitely. I think that's one of the most engaging for community as well, is to, you know, put a feed on, like Damien said, you know. The community, you know, has the voice. We're there for the community, you know. So for them to voice their opinion, we can infuse that into our work, you know, to help assess their needs and, you know, basically do our job. But on a minimal scale, like even just writing notes down for yourself, you know, time management. You know, what time do I have to be here? You know, what's the program about? What's the workshop I'm doing today with the kids? How many participants are there? You know, all that sort of stuff. What's the topic? You know, just if you haven't got like Microsoft Outlook, write it down on a bit of paper, you know, or in your diary or something, because then you've got that paper trail where you are, you know, and it's just sort of helping you be a better professional and obviously, you know, have that outcomes there for your people. Yep.
Man after my own heart.
Is that right?
Yeah, yeah.
All right, well, do you have a sort of a message, Summer, a sort of a take-home message for other communities that might be watching and interested in, you know, campaigns that they're thinking of doing or that may be underway with using evaluation techniques?
I guess we've already said it. All of us have kind of reiterated the fact that it's really important to evaluate and that you need to evaluate for a variety of reasons, whether it be for yourself, for your community, or for your funding body, or for future evaluation. And you're really not doing yourself or anybody else justice within your community or setting yourself up long term if you're not evaluating. And it doesn't have to be that hard. And if you do have some difficulties, make sure you build in some funding at the earlier stages so you can get somebody to help you evaluate.
Damien, anything you'd like to wrap up with?
My, I guess, suggestion would be, if you are evaluating campaign activity, is to set very realistic goals around the type of objectives you're going to achieve. So if you can't measure it, then it's probably not a good idea to put it down as an objective.
So Damien and Summer working on larger social marketing campaigns. I guess, Wayne, a message from the clinic level, the local community clinic level?
I think, you know, you talk about evaluation and people just start running, you know. It's a scary thing. It's a big process, depending on your project size and all that sort of stuff. But I guess my message is to take small steps. Research what you're doing. Have a look, you know. If you haven't got the internet, to look at Google, ask the people around you. Ask different strategies or processes or tools that they may have that you can utilise or take bits and pieces out to infuse into your work to make your job a bit easier, because evaluation is time consuming. I guess just show a bit of initiative, be proactive about what you're going to be doing, and just take that step up and have a go at it. Yep.
Thanks, Wayne, and thank you to our panel: Summer Finlay, Wayne Hippai, Damien Chen. Thank you very much for watching the Be Strong No Smokes What Works program. For more information about the Be Strong series, go to the Rural Health Education Foundation website and click on the Be Strong program link. Thanks for watching.